Hello, and welcome to the Functional Nurse Academy podcast. This is your host, Melissa Schreibfetter, owner and founder of the Functional Nurse Academy. Welcome, everybody. Today, I am doing another solo show because, oh my goodness, there is just so much going on in regards to just current events, especially when it comes to President Trump's executive order in regards to the CDC childhood vaccination schedule. I want to cover that. And then I had done a show a couple of weeks ago about the Fauci diary entries, which again is still so shocking to me that his judgment was just that poor to record all of those things on a government computer. But now we have all of these text messages coming out from his government iPhone. So I want to cover that as well. Also in regards to the COVID vaccinations and pregnancy, because we are seeing so much come out now. There are a lot of politicians and other commentators and journalists saying things like that the government hid a miscarriage rate of 82% when the COVID vaccine was given in the first trimester. So I'm going to do a deep dive on that. And I'm going to talk about, where are they getting that number and is that number accurate? So the first thing that I wanted to start with was just giving some clarity on this executive order coming from President Trump, because we know that U.S. vaccine policy is a hot topic. I'm actually really happy to see that we have an administration that is even talking about it, because just talking about the CDC vaccination schedule, just talking about it about 10 years ago, it's still controversial, but it just was not socially acceptable to question anything, despite the fact that we know that the number of vaccines on the schedule has just climbed so significantly over the years. And a lot of parents have questions about that. What changed in public health that, caused a need for the vaccine schedule to jump the way that it has? My parents' generation, they're boomers. They had about 6 total shots. My generation, I was born in the 80s. We had a total of 24 shots. The children today have well over 72 shots. So what is going on with that? And again, I hear the other side scream all the time. Correlation doesn't mean causation, but we know that sometimes correlation leads to causation. And around the same time that we saw the vaccine schedule increase so tremendously, around that same time, we also started to see an explosion in things like neurological conditions and immune system disorders. It's to the point where it's almost becoming normalized for individuals to have autoimmune conditions. And this is not normal. And I know that, ever since the fall, there has been some level of disease process because we live in a fallen world, but the increase, the levels of chronic diseases, especially in the U.S., it's astounding. And then when you compare the U.S. health outcomes to other developed nations, it's just not making sense. So we know that there's something that Americans are being exposed to that is causing our chronic disease rate to be so high, especially in a country that is so developed and we have such advanced medical technology. So let's go ahead and start talking about what this executive order means and what changes that we may actually see from this. So the major change, President Trump recently signed an executive order establishing what the administration is calling the gold standard childhood vaccine recommendations. Now, the previous CDC schedule covered approximately 18 different diseases. But again, remember, that was well over 72 individual shots. And with each shot, not only do we have, the antigen for the disease that they are vaccinating against, but there's also other ingredients. Some ingredients that are very controversial, such as aluminum adjuvants, such as fetal cell lines that are derived from aborted fetuses. So there's a lot of controversial ingredients in these vaccines. And the more individual shots that you have, the more exposure that you have. Now, the administration is now prioritizing against 11 different diseases. So when we are looking at now vaccinating just against 11 diseases, that is roughly around 27 to 28 individual injections from infancy through the age of 18, which again, that is very similar to the vaccination schedule back in the 80s. And I will say, we are seeing a lot of individuals in healthcare wake up and say, and they have questions about this. We're also seeing a lot of people really dig their heels in. And I will say, for me, when I had my first baby, I was very, very pro-vaccine. I did not understand why people were not vaccinating their kids. But then what completely snapped me out of that whole situation was just seeing a comparison of the vaccines I got being born in the 80s versus what my child was being recommended to get being born in 2017. And that's all it took for me to snap out of that, because that makes absolutely no sense. So it's really surprising to see so many healthcare professionals really defend this, the most aggressive vaccination schedule in the world, especially since our government has never studied that entire vaccine schedule. The government still has not produced a vaccinated versus unvaccinated study. I think if they really wanted to justify and prove the safety of that old schedule, why wouldn't they do a prospective study of children that had received the full CDC vaccine schedule, 70 plus vaccines, versus children that are opting out of that schedule and compare health outcomes? But for some reason, they just won't do that. So basically, they are recommending universal vaccination for a smaller group of diseases, and they are including greater individualized decision-making for the remaining vaccines. And the administration cites an HHS assessment comparing the U.S. schedule with peer-developed countries. And, they were seeing that other countries, such as Denmark, had excellent health outcomes, which again, I know that there are many, many different factors there, but we're seeing countries that have excellent health outcomes, and they are offering just a fraction of the vaccines that the U.S. was currently recommending. And then another segment of this executive order is parental choice and vaccine mandates, really going in to address that issue. So we know that in the vast majority of states in the country, parents do have medical exemptions, religious exemptions, philosophical exemptions, but then there are states that do not offer these exemptions, especially in California. California eliminated the religious exemption for vaccines, and then there is a medical exemption. However, how that legislation is written, what can happen is the California government is penalizing the physicians who are writing medical exemptions. If they write over a certain number of medical exemptions, which is not very much per year, then they actually run the risk of their license being under review. So in California, there have been situations of children that were actually injured from a vaccination, had a severe adverse outcome, but then were still told that they had to continue to get the vaccines or they would not be allowed to attend public school. That's a really big deal. And then we also have states across the country. For an example, I am in the great state of Tennessee. You cannot get more in the Bible Belt of Tennessee. We absolutely have a religious exemption, but a lot of parents were not aware that they had a religious exemption. And to this day, in 2026 in Tennessee, there are still pediatricians telling parents that their children cannot go to school unless they receive the schedule. Now, another thing, the administration is really encouraging states to reconsider their vaccine requirements, and it specifically emphasizes parental authority, religious freedom, medical exemptions, disability accommodations, equal protection. And again, the president is not eliminating state school vaccine requirements through that executive order, but they are encouraging states to align their policies with the new federal framework. And they are actually directing federal agencies to act within their existing authority. President Trump also had mentioned, as we know, one of the most controversial vaccinations on the schedule is the MMR. There have been many skeptics of this saying that combining measles, mumps, and rubella, that it is too much of an immune stressor for the child. And we do know that on many vaccine inserts, one of the known side effects is neurological encephalopathy, which is essentially swelling and inflammation of the brain, which then can lead to brain damage. And there are many parents that are reporting that following the MMR vaccine, their child was not the same and experienced regression and even autism-like symptoms. And what's interesting is Japan actually does separate the MMR. They actually have a single measles vaccine. So because there is such a high rate of parents reporting adverse events following the MMR, President Trump is recommending splitting those vaccinations up. That way there is less chance of adverse outcomes. So now I will say the deficit with that is that may take several years. I don't know what the timeline looks like for that, but in our country, we just don't have that available in the US. So I'm not sure how long it would take for them to get that on the market. Now, since this has happened, I have just been seeing just widespread propaganda. So we know all throughout social media, there are many social media docs that we know do make money from industry. Some of them have even come out saying that they're making more money being on TikTok and actually working as a physician. But we know that there are a lot of industry funded influencers that are just having a tantrum all over social media about this. But what is interesting is they keep repeating the same thing. Safe and effective, safe and effective. The science is settled. And it's like they think if we just hear the same thing over and over that we're going to believe it. But I think that so many of these influencers, so many people that are opposed to this executive order, I think that they are the ones that don't understand scientific integrity. Where in the world is the evidence that it is safe to give so many vaccinations in one sitting? And again, like I said earlier, where is that comparison study? Where is the study from children that are receiving over 72 individual vaccines to the ones that don't receive any at all, or even a comparison study from the children on the full vaccine schedule to children that their parents are choosing a delayed schedule? We do not have that information. Now, there are several studies that have actually compared vaccinated children to unvaccinated children, and they've looked at the health outcomes that have actually showed that there are more autoimmune conditions and more autism and just more chronic health issues in general in the vaccinated group. But those smaller studies continually are not accepted by the mainstream medical community. The mainstream medical community will usually find something about the study that they don't like, and then they will disregard it, or they will say, oh, well, the author on that study is an anti-vaxxer. But then we also have to understand that the definition of anti-vaxxer has changed. So someone technically is considered an anti-vaxxer if they question vaccine safety science, and also if they oppose any vaccine mandates, which is probably well over 75% of the country. How much of our country do you think would oppose a COVID vaccine mandate for an infant or a pregnant woman? A lot of them. So there are a lot of these smear tactics really against individuals that are publishing these private studies that may get results that the mainstream community does not like. I also want to mention that the vaccine autism debate is a very hot debate. And then we do have many people in the healthcare industry that are screaming from the rooftops that this is settled science. We don't need to look into it anymore. The one thing that we know that does not cause it is vaccines. But then when you actually look into those studies there, they have not checked the whole vaccine schedule. They have tested primarily MMR vaccine and the adjuvant thimerosal, which is a mercury-based preservative that is now being taken out of U.S. vaccinations. So again, we don't have the sufficient evidence to make that claim, and it's certainly not settled science. So moving on, I just have got to cover more of this Fauci debacle because, again, this really was the catalyst for me starting Functional Nurse Academy. So we know that we're trained in nursing school to be critical thinkers. I actually remember one of my nursing instructors telling us, you don't ever want to be the first person to take a brand new medication. You also may not want to take the medications that have been out the longest. You may want to take medications that have been out like a moderate level of time. So I just thought it was so interesting. We have a brand new vaccination with a technology that has never been successfully rolled out to the public. And then individuals were getting mandated to take this. It just didn't make any sense. And again, also during COVID, so I used to be a nursing instructor. I love education. And I remember when I was teaching new nurses how to use PPE, personal protective equipment, even using the masks. We had like a certain order that they had to put the mask on and how they had to discard it. And you were never allowed to just wear a mask into the bathroom or eat with your mask on. It is just silly. So, we are teaching students all of these techniques to properly use PPE. And then, COVID guidelines and nonsense roll out. And then, when COVID happened, I already had my business and I was doing pretty well, but I was working as a nursing instructor one day per week because I still wanted to keep my foot in the door with university education. And I was seeing that our students were given for an entire clinical, like 6 weeks of clinical, they were given one N95 mask to wear the entire time. So my students were showing up with visibly soiled N95 masks. I mean, can you imagine what is growing on that? I actually went and bought new masks for them because that is so unsanitary. And again, I am all about a medical grade mask. Say that when you're cleaning up a patient and they're really ill and they're hacking and they're coughing and there's droplet precautions or they're vomiting and things like that, I think that there is appropriate use of PPE. But they were being instructed to just wear the same mask for like an entire clinical rotation. And then you weren't allowed to ever take your mask off, right? So they were even wearing their masks in the in the bathroom, and then going to like all of these different patient rooms, and think about how uncomfortable it is to wear a mask all day and how many times you're like touching that mask with your hands. And then you're just transferring all of this like viral and bacterial particles everywhere. It was just so incredibly insane. But again, I actually was one of the nurses. I was not officially, I didn't like, my boss didn't tell me that I was fired. However, after I was talking to my students about the safety concerns of the experimental COVID vaccinations, and then I refused myself to get the COVID vaccination. I was not invited. I was not offered to come back and teach any other clinical. So I don't know, maybe I was technically fired. But anyway, I really wanted to bring back critical thinking to nursing. And we know that this whole situation has just squashed trust of healthcare professionals. I actually had an instance where my little boy, he was, gosh, maybe 7. And he had like a pretty bad cold. I was doing all the natural things. Well, he started to get worse. And I'm a nurse, so I have a stethoscope at home. And I was listening to his lungs. And I was like, okay, I am hearing diminished breath sounds. And again, like as a nurse, I know, okay, that's probably pneumonia. I'm not playing around with pneumonia. You need an antibiotic. So I took him to the urgent care. And my son, who is a child, a 7-year-old boy with diminished breath sounds, they refused to provide care for him unless I put a mask on him. It's just so insane. So again, so many of the nurses that are not okay with this, those nurses do not want to work in that system anymore. And that's why I think that we're seeing this amazing explosion of nurses starting functional nursing businesses, because these are a lot of the nurses that they're not okay with what the current system is doing. And they actually want to get people well, which we can get people well when we work outside of the system. So anyway, we need to cut to break just for a minute, but when I come back, we are absolutely going to do a deep dive into some of Dr. Fauci's text messages, and we're going to talk about this controversy of the COVID vaccines in regards to miscarriage. If you are a fed up nurse, I can absolutely train you. At the Functional Nurse Academy, we are the leading and most comprehensive functional nurse training on the market for LPN, RNs, and nurse practitioners. All of our students receive 90 nursing CEs, eligibility for multiple board certification titles in functional medicine and holistic nursing, and they also get the business tools to help them succeed in private practice. All of our graduates also receive 6 months of live business mentorship with me. So if you're interested in training with me, click on the link in the show notes to join me live for my next informational and Q&A webinar. You can also check out the Functional Nurse Academy website at functionalnurseacademy.com. This show is also syndicated on America Out Loud Talk Radio, on the Nurses Report radio show and podcast. So you can also find me there on any major app. Welcome back, everyone. Today we are talking about current health-related topics because, oh my goodness, there is so much going on right now, and there is a lot of censorship about this issue. So you would think that this would be, well, not in the clown world. If we were not living in the clown world, you would think that this would be widespread mainstream news, the controversy about Dr. Fauci's text messages coming out and their recommendations to offer very controversial COVID vaccines to pregnant women despite safety signals. But there's quite a bit of censorship. So I figured I would do my part and I would cover this. So let's go ahead and go over what is going on. And then let's also talk about that 82% number. So we do have these newly released text messages recovered from Dr. Fauci's government phone. And we're seeing a lot of contradictions. There's so many contradictions when we look at his emails and his text messages, and then we compare that to his public messaging. So in January 2021, this was right before emergency use authorizations began. Now, Dr. Fauci was privately raising concerns with the CDC director, Rochelle Walensky, and also with the Surgeon General, Vivek Murthy. And so he actually wrote in a text message to Dr. Walensky, who is CDC director, since many people have significant cytokine storm and fever after the second dose, this theoretically could be associated with miscarriage in the first trimester. I also just want to chime in real quick, a little more background information. The show I did 2 weeks ago, I covered where Dr. Fauci had confirmed there was a confirmed email that he responded to that did bring to light that he was well aware that the mRNA lipid nanoparticles were not just staying at the injection site, which was a ridiculous statement to begin with, but he knew that those lipid nanoparticles were in fact getting into the placenta and were able to cause an immune reaction in the fetus. Any doctor knows that an immune reaction in the fetus can trigger a miscarriage. So anyway, we've already covered that, those in the emails. So he knew that information. He knew it. And so Dr. Walensky, when she got that text message from him, she says she agreed and said it was definitely a good point, especially after dose 2. And something else I want to mention. So we know the VAERS data, vaccine adverse event reporting system. There are several studies confirming that VAERS is a horribly broken system and only picks up about 1% of adverse effects. However, we can still use it as a safety signal. There's another database called vSafe. So we knew per the vSafe database that approximately 7% of individuals after receiving their COVID vaccines were actually needing to seek urgent care. So these are people having chest pain, pulmonary embolisms, like what Dr. Fauci had, severe reactions that were requiring medical care. So we knew from the beginning, like this is a high risk product. And also, there were also red flags in animal studies as well. So there were studies that had shown that specifically Moderna's mRNA vaccine did cross the placenta of pregnant mice within an hour and entered fetal circulation, and it was accumulating in fetal tissue. And then there was, this is a study that I was like screaming from the rooftops about, guys, back in 2021. So, and again, like we have these government officials, and then they come out and they're like, well, there's a study, the expert said this. But what we have learned throughout the COVID era is there are so many ways that you can manipulate a study to get the results that you want it to say. And then we know how, unfortunately, it's so powerful when you have someone that's an MD and they come out to the public and they're like, well, this is what the science says. So let's look at this controversial study that is at the heart right now of individuals saying that there was an 82% risk of miscarriage with the COVID vaccinations. Okay, so this is a study, and I'm going to try not to butcher his last name. I promise it's harder to say than Schreibfetter, but this was led by Tom Shimabukuro, and this was published in the New England Journal of Medicine. And then this study carried so much authority and assurance that this is what, OBs across the country and all of these health officials, this was the go-to study to reference the safety of vaccinating pregnant women. So, now here is the issue with this study. Okay, so they're actually, shortly after it was published, they actually received a letter to the editor from other healthcare professionals that were like, hey, your math is wrong. You need to fix your math, because when the math is corrected, it actually shows that there is a safety signal. So what this study did is, in the study, they published that the background rate of miscarriages under 20 weeks is 10 to 26%. Okay. So they're saying that, like, okay, that is like the average miscarriage rate. And they published that within their findings of women in the first trimester receiving the vaccine, that background rate was 12%. So they were like, hey, it's safe. There's no difference, because that rate, it falls within the background rate. However, this is where they modified the data in the study. The definition of a spontaneous miscarriage is the loss of an early pregnancy, which occurs before 20 weeks gestation. Okay. So keep that in mind. Now, when they got these numbers, so they actually included 700 women that received the vaccine in the third trimester. Okay, so let's think about this. If a spontaneous abortion occurs, well, it's also called a spontaneous miscarriage. I hate the abortion word. So if a spontaneous miscarriage occurs under 20 weeks, okay, and for a spontaneous miscarriage to occur, the fetus needs to be 20 weeks or below gestation. So if they included an additional 700 participants of women that received the shot in the third trimester, they cannot possibly be classified as being at risk for a spontaneous miscarriage, because they're far past the 20-week mark. So that when you take that study, okay, so we're kind of like, oh, okay, 700 women actually didn't qualify to be in this number. So they essentially had the denominator wrong. Okay. So when you correct the denominator with the correct information, which how many women were in the study that were in the first trimester that received the shots? Well, that's 127. When you correct that denominator, that is where that 82% rate comes in. Now, again, this number is being repeated over and over by people who are COVID dissonant. When you correct the data in the study, that is what you see. But we also want to take into consideration: are we seeing that in other data sets? Now, we're seeing a lot of pushback on these numbers. There are many very pro-COVID vaccine health so-called experts and physicians, and they're saying, no, that study is not reliable because it turns out they just didn't have all of the information. And again, with propaganda, usually what people will do is they will just throw out so much confusing information that the public gets overwhelmed and they just don't know what to believe. So shortly after these conversations took place, and then after this study was published, again, the study was like the wrong denominator, because apparently the top healthcare officials in our country cannot read a study and do the math. That is when we had just widespread guidance and assurance to pregnant mothers that it was totally safe for them to get the vaccine in any time during pregnancy. So in September of 2021, Dr. Rochelle Walensky made a public statement saying there is no bad time to get vaccinated. She also insisted women to take the shot before conception, during any stage of pregnancy, and after delivery. And then per CDC estimates, by about April of 2022, nearly 74% of pregnant women in large U.S. healthcare networks had completed the primary series. And I also do want to mention, I want to circle back around real quick just to the red flags in animal data, because even before the human rollout, there were warning signs. So to give you an example, Pfizer's animal reproductive toxicity study, it actually documented a pre-implantation loss rate of embryos failing to attach to the uterus in 9.77% in vaccinated rats, compared with 4.09 in controls. Okay, that is a rate that is double. It is double in the vaccinated rats. That is a significant safety signal. However, Pfizer, since they're just such an ethical and honest company, they decided to dismiss those findings. They said it was biologically insignificant. And then again, I remember I had a copy of Pfizer's pharmacokinetic study. I had it sitting on my desk, and I would use it to educate the clients I was working with. So we know from Pfizer's own studies that the biodistribution studies showed that the lipid nanoparticles migrated beyond the injection site, and it was getting into the reproductive organs, including the ovaries. So this is something that really did warrant rigorous follow-up instead of this just sweeping public assurance for safety. There continue to be more signals in early pregnancy. So to give you an example, a large Israeli study of over 226,000 pregnancies analyzed miscarriage risks according to the timing of vaccination. And so we saw that the clearest signal was among women who received their first COVID-19 shot between 8 and 13 weeks of pregnancy. So again, those are the early stages of pregnancy. That is the first trimester of pregnancy when the fetus is the most sensitive. So in this group, the model predicted about 9 losses per 100 pregnancies. Okay, so again, that's around the background rate of around 9% or so. Instead, there were 13 losses, which that's kind of similar to the safety flag that they saw in the animal model. So again, going up from 9% to around 13%. So that's a red flag. And then there is another safety signal. So there was a CDC analysis of the V-Safe registry that we also saw a similar pattern. So researchers compared 7 major birth defects that they know tend to occur during early embryonic development. And they examined women before 14 weeks against those that were vaccinated later in pregnancy. And then every one of those 7 defects was actually more common following early vaccination. However, the CDC analyzed each rare defect separately, and because none individually reached statistical significance, the authors concluded that there was no significant difference between early and later vaccination. But the published data allowed 6 of those deficits measured across the same population to be evaluated together. So when combined, the rate was almost twice as high following early vaccination, which was 0.94% versus 0.49%, a statistically significant difference. So again, it looks like you have a it looks like we're seeing across the board, it looks like there's about double the risk of miscarriage for women that were receiving these vaccinations in the first trimester. I also want to mention we do have so many healthcare professionals, and it really does make me sad that there are still OBs and individuals working in women's health that are telling women to get these COVID vaccines. So according to the most recent CDC data for the newest version of the COVID vaccine, approximately 11% of pregnant women are getting these vaccines. Now, I do want to mention that there are some courageous clinicians on the front lines. So there is an obstetrician. Her name is Dr. Kimberly Biss, and she came out about this. She's actually a senior fellow at the Independent Medical Alliance. And she said that the miscarriage rate in her practice averaged about 4% back in 2020. And then she saw it double in 2021. So again, 4% in 2020 and then 8% in 2021. And then she said it reached 15 to 16% in 2022. She says she began practice back in 1998. And then in all of her years, she said that she's never seen anything like this. And she also came to mention, she says, we never gave anything brand new out of the gate to our pregnant patients. She said before COVID, that would have been considered malpractice. She also estimates that roughly 60% of pregnant women in her practice were COVID vaccinated, though she could not confirm the vaccination status of every patient who miscarried. And she argues that such a dramatic shift within her own practice should have triggered an urgent investigation instead of dismissal. And I will say, I have heard many different things from individuals that are working with pregnant mothers and are working with infants. I have actually heard from friends that are in pediatrics that after the rollout of the vaccines that they were noticing that there were more abnormalities in children that were born to women that had received COVID vaccinations. We also know that there have been reported cases of increased stillbirths that also occurred after the rollout of the COVID vaccines. Specifically, the state of Mississippi actually declared a state emergency over the increase of stillbirths that they are seeing. And again, these are things that warrant serious investigation. And what they really need to be doing is looking like again back to the vaccinated versus unvaccinated. There are many, many, many women that refuse to get the COVID vaccine, such as me. I am not COVID vaccinated, but I got COVID. And I just recently had 2 back-to-back babies because I also do understand that COVID itself can cause issues. Okay. So, you really want to look at these outcomes of the COVID vaccinated versus the COVID unvaccinated. And then also, with any type of medical intervention, it's always risk versus benefit analysis. And we knew from the beginning that these shots, they were never tested for their ability to stop infection. It's always been about the potential of them maybe being able to decrease symptoms. But when we look at pregnant women, a healthy pregnant woman, they are not much of an elevated risk for COVID than the general population. And I also want to mention, so there's been even additional studies. There's just so much information to get out there. So Pfizer did eventually launch a dedicated randomized trial in pregnant women. And this was supposed to provide the evidence that was missing from the original rollout. So the company planned to enroll 4,000 women, but recruited just 348 before the trial was terminated early. And then the participants were vaccinated between 24 and 34 weeks. Again, like you're designing the study to get the results that you want to get. So we know that miscarriage, again, that is the highest risk for under 20 weeks. So why in the world, if they're trying to come out and prove a point that it's safe, we're just not going to study that population. We're going to study, 24 to 34 weeks. So anyway, the trial size was very small, but even though this trial size was small, it still produced a notable numerical imbalance in adverse events among the infants born. And this includes major congenital abnormalities and developmental delays. And these abnormalities occurred in 8 of 156 infants. So 5% in the vaccine group compared to just 2 in the placebo group, which is 1.3%. And then when these results came before the CDC's Vaccine Advisory Committee in September of 2025, the then chair, Martin Koldorf, he challenged Pfizer over this because from this data, he calculated a 4.1-fold higher risk in the vaccine group, which we know that that is statistically significant. And I really think that there's just so much to say about a society when you just watch how they are treating vulnerable populations. So again, going through what I covered on the show, the claim that it's across the board 82% risk of miscarriage, I would like to see more data on that. But when we look at other studies and we look at animal trials and the safety concerns, we know there's a significant safety signal there. And there were enough of these safety signals to use some common sense and not recommend this to the most vulnerable population. And it is really concerning to me that these shots are even still on the market. I'm a big believer that they should be pulled from the market. And they're still, to this day, are OBs telling pregnant women that they should get the COVID vaccine. And then what I think is even, it's all so sad. But the most recent COVID vaccine, approximately 7 million children in our country have received the most updated COVID shot. And then again, when we talk about these safety signals, and I did mention that the VAERS database, it is very much so lacking. It is a self-reporting system. It cannot verify causation. It may pick up only 1% of these adverse outcomes, but there was a stark increase in reported miscarriages from that database. And again, that's another component that needs to be investigated. Now, there also was a peer-reviewed study that was published from Thorpe and colleagues, and they actually did analyze the reports of miscarriage following the COVID vaccines. And then they also compared that to the reports of miscarriage following the flu vaccines in pregnant women. And they said that according to the data, miscarriage was 100 times more likely to occur from receiving the COVID vaccine than from the flu vaccine. So again, there's just so much to think about. And especially when we look at pregnancy for a healthy pregnant woman, the survival rate is around 99.8%. So why in the world would we take that risk, especially when we know that this vaccination is also not going to prevent you from getting COVID? So moving forward, I know that this is not a pleasant topic, but again, it's just something that must be covered because history tends to repeat itself. And like I've said before, we cannot outsource our critical thinking and our discernment to individuals in white coats. And then we also see, if we just know a little bit about history, it wasn't that long ago that the U.S. Surgeon General was telling pregnant women that they should smoke cigarettes. There have been many, many, many times that the government has given horrible health advice. And we also know that individuals that hold positions in high government roles, we know that they are prone to corruption. And we also know that there's so much industry corruption. For an example, the pharmaceutical industry, they outspend oil and gas by 3 times. So just to give you guys an example. Okay. In 2025, if you look at the Open Secrets website, you'll see that the pharmaceutical industry spends about $451.8 million on lobbying efforts. And, you would look at that figure and you would think, okay, well, is that like an accumulation over several decades? No, that is what they spent just in 2025. And that's why we see that there are so many of our legislators that are really just parroting talking points from the pharmaceutical industry. And like I mentioned before, I'm a big believer that these COVID vaccinations should be pulled off of the market. But we only have very few legislators that are calling for that. I mean, I believe it may even be less than 5 of them that are calling for the shots to be pulled off the market. So again, I think that we are seeing some positive changes. We finally have an administration that is saying, hey, we should research the causes of autism. We should be looking into things like aluminum adjuvants. No, we should not be providing over 70 individual vaccinations to our children because that's insane. So we have an administration that is recognizing some of this, but it's up to the public to be informed and to share this information with other individuals, because I know that there are so many good people out there that really want the best for their children, and they were scared. When we are scared, we may not make rational decisions. And I think that there are so many individuals now that are suffering. There are even parents that have lost their children to things like myocarditis, and their children are not here with us anymore. And now they realize that it was never worth it. The risk versus benefit assessment to give their healthy child that shot just wasn't there. So again, we really need to focus on education. And again, this is one of my favorite things about being a nurse. One of our most important roles are as nurse educators. And there's really so much impact that we can have by getting this information out. So I will be posting my references in the show notes for you all to take a look at. Thank you, everyone, for listening to the Functional Nurse Academy podcast. Please be sure that you like, subscribe. You can also follow the Functional Nurse Academy podcast on our YouTube channel. And if you could do me a huge favor and write a review, that would be amazing, because that can really help to boost us up in the algorithm. That way more nurses can find us and learn about the functional nursing movement. Until next time, be safe, be well, and God bless.